you can see, I think this is also for me a really excellent point, and then we'll transition over into cannabis hospitality. Um, as you can see, and that's why we called this policy boot camp, there's a lot of different levers that sort of gets pushed and pulled as policy is being made. I talked a little bit about this at the Medical Cannabis Summit, but I think here's a good time to talk about that now. There are lots of different ways rules and laws get made. In Washington State, at the state level, we have rule, that's the statute. Oh gosh, and I'm always, and then there's rule. That's the WAC, Washington Administrative Code. And then statute is RCW's Revised Code of Washington. I got it right this time. All right. So those are the two main rules. Anything that's in law or in statute, that RCW, that is laws that are passed by the legislature, what we primarily are talking about here today, and signed in by the governor. Then also, there's a couple of other ways that we can write statute, and that's through a ballot initiative, which is how I-502 came into be, which was enough people got enough signatures to put something on the ballot, and then enough Washingtonians said, yes, we want this thing. And so that was then put into law. Then after that, there are rules. Rules often come from laws. So for example, 5403 was the law that was passed. This is again about the limiting the 5 retail stores. And the law as written exists. It looks like that law is going to go into effect before we complete the rulemaking process, which means any enforcement that is happening may not have a whole lot of detail around it other than what is exactly in the law and using the plain language of the law to do that. There's a lot that's problematic about that. We'll talk more about that when we get to LCB restructuring, I believe. But then what happens next is that we go to the agency level, and then there's a Washington Administrative Code has some really strict requirements about then the rulemaking process and how then the rules get put into law, which requires stakeholder feedback, draft language that moves through the stakeholder feedback, and then a process within that agency to then turn that rule into law. Then also that's at the state level, and then at the local level, both in the cities and counties, there's something called preemption, which is when the state law meets the local law, and who has the authority to override the other. A lot of times, cities and counties are fighting for to make sure that their jurisdiction remains sovereign to some extent, and that state law is not overriding what they are doing, because a lot of times their scope is significantly more narrow, and what they are allowed to do differently from the state. Cannabis in particular is one of those where preemption has been talked about a lot, because sometimes cities and counties, like in this case, might have put in place a ban or a moratorium. While those are in place, however, the state has still issued licenses because it is legal by state law. So the state has continued to issue licenses, sometimes in municipalities that have passed a ban or a moratorium. And there's a lot of tension between the state and cities and counties that has happened. And honestly, that's how I got my start in cannabis policy here in Washington State, was a really significant battle in Chelan County early on that well, that's a story for another day. But a really big challenge there, and remains one. And in particular, right now, in the face of these 109 social equity licenses that are in place. And so all of the law and rulemaking needs to happen at the city council or the county council level, sometimes taking a little bit longer of a process. Now, sometimes, as is the case with this, there can be laws and rules and city and county regulations happening all at the same time. And so for somebody like us, the Cannabis Alliance, in particular around things like the citing of these retail stores, we're trying to pull on all of the levers simultaneously and build momentum in the legislature, at the rulemaking level, and at cities and counties. And so that as that momentum builds, one sort of feeds the other, so that folks are starting to feel like it's okay to start lifting some of these restrictions, and actually be able to cite some more of these stores. You've heard this mentioned now in a couple of our seminars. a lot of times lawmakers like to see successful implementation of these rules someplace else. And so when we can start to sort of build a story that this is happening in a lot of places with a lot of success, whether that's in another state or a neighboring city or county, as well as adoption at the state level or in process at the rulemaking stage, that's when we actually find the most comprehensive success across the board. Divide and communicate one pager. Say more, Mike. All right. Jessica, that was fantastic.
You want me
Thank you
to?
so much. Yeah,
Just real briefly. Sure. What I was thinking was, instead of, especially in your local area, if you know people, you can dive into that and you might be able to share lessons learned across, and so maybe there's a spreadsheet to share that, or there's various ways you can do it, but definitely, if like in Oregon, we had lobbyist, Anthony was lobbyist down there for medical, and so he kind of covered everything. And you'd have subcommittees, and people go off and do things. But here it might be, and I haven't, I'm kind of new to this state in terms of what you're doing. It sounds terrific. So I'm just wondering on the communication how that works. If I'm going to say something, I'd like to make sure I'm reading from the script, so to speak, and adding to it and all that. So that's about it. Thanks.
perfect. Thanks, Mike. And we are still in development. This is in particular for our legislative packet, but point well taken. And I think this is our very first policy boot camp, and I have multiple notes of ways that we can improve this for next year and ways that we can build this more successfully into our broad policy agenda, not just at the legislature. So thanks for that recommendation, Mike. I agree wholeheartedly. Um, now, I'd like to now take this opportunity to transition into our next seminar. We do have a 15-minute break after this one. So thanks for hanging in. And this one is in particular really exciting. We're going to talk a little bit about cannabis hospitality, some just brief background. We were working on cannabis hospitality at the time. We were calling it social consumption in 2018 and 2019. We were starting to get some really serious momentum and actually some potential bill draft language going. And then the pandemic hit. You can imagine the impact that pandemic had on the viability of a social consumption bill. And so now we're back. A bill was filed. The bill is called social consumption. However, you'll notice that this says cannabis hospitality. I'd like to introduce, I saw you come on camera for a minute, Lotta. I can pause if you need. You're good. Okay. I'd like to introduce Charlotte Brathwaite. She is a member of our board as well as the chair of the Cannabis Hospitality Committee and has really taken this on. I'll let you talk a little bit about the other ways that you contribute to the cannabis industry, especially after having just spent a little bit of time in Las Vegas and going to some consumption lounges there and lots of events. I'm really fired up about this one. So Lotta, I'll let you take it from here. Thank you.
Thanks, Caitlin. I appreciate it. Hey, everybody. I'm Charlotte Lotta Brathwaite. Friends call me Lotta. And as Caitlin was saying, I not only run my own company called the Bakersman Collective. We do social media marketing, content production. I also am the general manager at Nimbin Seattle, a dispensary in the White Center area. And clearly serve on the board of the Cannabis Alliance as and the Cannabis Hospitality Chair. So what I just dropped in the comment or in the chat box there is something we worked on with the Cannabis Hospitality Committee to kind of bring everyone up to speed on where we are in Washington with our hospitality efforts thus far. Let me share my screen as well. Losing some of these forms, but the goal was to sorry, brain documents. The goal was to let folks know we have a long history of cannabis hospitality here in Washington State with the Hemp Fest event, which is the largest free speech event that occurred at its time during its heyday. And from then on, we've continued to discuss with subject matter experts all over the nation in regards to, yep, Tempest, to this. Nate, I'm having a little bit of issue sharing these graphics. Do you think you could help me with that? I'm sorry. I would like to pull up the.
Screen share should be enabled. Um,
Okay. The slides is.
and also, are these the graphics for the cannabis hospitality dashboard?
Yes.
Wonderful. I have Lotta has sent me over some screenshots that she would like to be shared. She has will be explaining the resource a little bit further, but
Mhm.
I've sent a link to a file within our Google Drive where these documents can be reached. And to Fortuna's point earlier, will be sent out in my follow-up.
Thank you. Sorry. I had to pause everybody because I'm trying to pull them up, but it's just not allowing me to.
Let me see
Um,
too. Let me see if I can just pull it up here based on that link, Nathan, and then maybe I can just share let me do that. I also want to flag for everybody. I did put the one pager in the chat as well that we are sharing with policymakers. Um,
Got it. With that case, we kind of presented the argument here that Washington State renters, consumers, and industry alike would benefit from support from the hospitality sector or from some cannabis hospitality, right? And some of those facets, we can do market insights to start would be the easiest one. So we have a total population of 8.404 million individuals, right? Our renter population in Washington State, 2.89 million individuals. And we receive quite a bit of money from said operation and legal industry here in Washington, except none of those funds are from tourists or from the hospitality sector, if you will. So we have a potential of 1.69 shoppers. We have 110.8 million tourists that come to Washington, and it would be far from us to presume that these individuals, one, not only have a safe space to consume in, but two, don't come here for our quality cannabis that we have in this state, right? So, if we zone in a little bit, we have a renter share or a renter population of 304 or so thousand individuals in Seattle alone that do not have a legal space to consume. So you can head to the next image right there. So if we compare that to something that the Liquor and Cannabis Board also regulates, right? Alcohol, for example, we have over 9,000 places, venues, so not wholesalers or distributors. And I have to add a caveat to y'all listening. I am at an active retail shop right now. So if you hear coming in and out or doors or sounds of business, that's where I'm located. But over 9,000 venues where you can just consume alcohol. We have zero for cannabis. And that seems a little bit unfair in my opinion. With that, you can kind of look at the enforcement and safety numbers that we have here. So over the years, the violations don't quite compare. There are what, 23% violation rate in 2024 alone, whereas in the cannabis industry, we had a 6% violation rate. That means that as a regulated market, we adhere to the rules that is required of us quite well, right? And I think that with that in consideration, or I know that why wouldn't we have an opportunity to provide, in this particular case, right, as the bill speaks, event banquet licenses? And so can you show the next screenshot for me? Thank you. And this is just a market scale of what you're looking at, right? Where the black dots are some of the larger municipalities or counties where retail sales occur across Washington, and you know that there are gaps. So clearly, we are missing potentially due to bans, moratoriums, um, a place where consumers can actually reach the product, right? And look at our trends since 2018 to now. We had our boom with COVID, and now we're sort of dwindling down. So, what are ways in which we can influence and better support our regulated market as a state? Those are some of the considerations we had as a Cannabis Hospitality Committee. And with that, you can go to the next slide, Caitlin. This is kind of a zoomed out view. You can see where the retailers are sort of located within Washington. We thought, how can we kind of cover the map entirely? Now, our solution with that is House Bill 1932, with, of course, the support of Melanie Morgan. And I'm going to drop that language in the chat so you have a resource and access to that. But I wanted to spend some time now discussing this bill, which we hope brings us a little bit of relief. All right. So House Bill 1932 was introduced in 2025 or the 2025-2026 legislative session, because of course this is a biennium. It's a major piece of cannabis policy reform focused on authorizing cannabis consumption in regulated environments beyond private residences. And so a little bit of background on that. Despite legal adult use cannabis in Washington since Initiative 502 in 2012, there remains a significant gap in the regulated market. No legal spaces exist where adults can consume cannabis product outside their homes. And in fact, it is a Class C felony to do so. So many consumers live in situations where on-site consumption isn't feasible, such as rentals, shared housing, or environments that prohibit use. House Bill 1932 aims to address that gap by creating regulated pathways for public cannabis consumption that aligns with the original intent of a tightly regulated adult use system. So, a few core provisions. At its core, House Bill 1932 would create a new license type, a cannabis consumption event organizer's license, allowing licensed entities to organize and host regulated cannabis consumption events under the permits used by Washington State Liquor and Cannabis Board at this time. So it would allow these event organizers to sell and serve single-use and ready-to-consume cannabis products directly to 21 plus on-site and in controlled areas. They could establish training and permitting requirements for employees to work these events. And the idea is to regulate overconsumption, which we have seen from the context of a consumption lounge model. We didn't, with this bill, think that just going that route would be successful because as a state, we have, I guess, and Caitlin could chime in on this, bipartisan belief in our Clean Air Act, right? And so we thought, okay, but if I was going to an event where it was allowed for me to consume outside, on a back patio or something, right? This is a solution that sort of bridges the gaps. Or if I wanted a fine dining experience of infused cooked meals, like these are the different ways entrepreneurs could then begin to engage in our regulated industry in a way that sort of fits their lifestyle, right? So for this to go, it would require a the LCB, so WSLCB rulemaking on event approvals, consumer protection standards, and conditions for operations. And these events are sort of envisioned as legal venues. So as I discussed, we were thinking tasting, other consumption-focused gatherings. Like I've participated in, yoga events where you consume first and then stretch, and sound bath experiences, float experiences, and these should, in my opinion, be legally regulated because they're things that I want to participate in. All right. So and I think a lot of people do if they were allowed to. So, the goal is to have events where cannabis can be enjoyed responsibly with regulatory oversight, similar to how alcohol consumption and events are regulated. In fact, we as a state have like loosened or changed some of those regulations for alcohol consumption because we know FIFA is coming. So now you can walk around a sports arena with open consumption publicly, yet it's still illegal to smoke a joint on a street corner. Right. So, policy rationale. Sponsors and supporters argue that creating legal consumption spaces would provide public safety benefits by reducing unsanctioned public consumption, close gaps in the adult use market by allowing responsible, controlled environments for consumption, and expand economic opportunities through event licensing and tourism-focused activities, right? Empower businesses with new revenue streams tied to regulated consumption while improving visibility and legitimacy of the legal sector, right? So, of course, there is going to be a debate, but I personally feel that we're up for the conversation. So, during committee hearings, thousands of public commenters have weighed in. The support tends to come from the industry itself and advocacy organizations, emphasizing consumer safety and economic growth. And in contrast, some law enforcement and public health groups have expressed concerns, particularly around impaired driving risks and public safety if consumption venues are not carefully regulated. So those are considerations that we really should ponder and be able to respond to if you participate in the 2026 legislative session by providing testimony towards this bill. All right. Um, there are a couple of fiscal and administrative considerations that I believe we are still waiting on with the bill as proposed. So, an official fiscal analysis for this bill projects new licensing and permit fees that could support state programs and enforcement. Revenue estimates, including license application and renewal fees through ongoing costs, will depend on rulemaking and the number of events authorized. And Caitlin, again, you could chime in here. I think we are waiting from Melanie Morgan or the legislature to provide a fiscal note along with this bill thus far to show us in the times of a budget deficit what we're offering to the state is a little bit of coin, so in my opinion, this makes it a bill worthy of consideration by those parties. So where the bill stands, as of most recent status, House Bill 1932 has been introduced and heard in committee, but has not yet been passed into law. It remains under review in the House Consumer Protection and Business Committee. And I was going to pause here to see if there were any questions or comments in here. Someone said, or at a golf course. Great. It seems to me more that the lack of violations is more a result of lack of enforcement rather than compliance. Um, uh, no, I think we're at a 97% compliance rate with age gating here as industry, and I have been a part of LCB stings at shops, so that enforcement does occur. Um, Sorry, Clean Air Act is for smoke from tobacco, not for cannabis exposure. Different, except for smoke, but is it really different to our legislature? I don't believe so.
I was going to
Uh,
say, and that might be a differentiation between the federal versus Oregon versus Washington, but in Washington, it does include, I mean, cannabis smoke is included in it, smoke of any kind.
mhm. Uh, and then so I'm sorry, the final question was how do we deal with the Clean Air Act? And maybe Caitlin, you can jump in to give us an answer for that.
Yeah, we don't is
Mhm.
the answer. So what we're looking at is outdoor spaces. It can be tented, so there can be a canopy there. Um, but looking at ways to, if there is going to be smoke or vapor in that way, that we're doing those outside under a canopy with heaters. There's a lot, I mean, see, I want to be delicate about how I say this. uh, we all have been to, especially, I'm going to say it this way, me and my travels across the country, and dealing with lots of other folks who are also doing cannabis policy work. I've been to plenty of consumption events. I've been to plenty of events where people are consuming cannabis. And by and large, most always consumption is happening outside and not inside, anyways, under canopies or with heaters. I think we've got lots of solutions for how to deal with that. But I believe in Nevada, there are some, you can smoke indoors, and there's a lot of sort of requirements around charcoal filters, downdrafting, HVAC systems. Like you can get a pretty sophisticated HVAC system going with regulations where the smoke is not lingering heavy in the room. You know, I've been to a long, long time ago, once upon a time, an indoor cannabis party, and it was a hot box. I actually didn't smoke at all by the time I got in there, but by the time I left, I was a little bit high. And it was fun for those of us who were there. But in terms of sort of a public facing business that's regulated by the state, not what we're all looking for, right? And then I have been to Planet 13 as well as Nuwu in Las Vegas, and those venting systems are, I mean, I was there with Lotta at Planet 13, as well as a few other folks here. We smoked a joint together, and that smoke did not hang around. It was not a smoke filled room that we were in while we were there. So Washington, I don't think we're going to get indoor smoking anytime soon. But you know, there are some pretty cool science things to get us there. Lotta, can you talk a little bit about this rebrand? You've heard us use terminology social consumption as well as cannabis hospitality. Can you talk a little bit about that terminology? As Jessica said in the last time, language does matter. What's the logic behind?
Yes. And I will do this as quickly as possible because I've got a staff member doing a deposit with my ATM, so it's real noisy. What I will say is that the rebrand is happening, I personally believe, on a national level, but in particular here in Washington, because we've had legislators come to us that said social consumption sounds like a disease. I don't really like it. It almost sounds like tuberculosis, and it is. It also immediately brings your mind to consumption lounges, right? And what we have seen as an industry is that that is not necessarily a viable business model, from the extreme cost of insurance, and the overall success of these businesses. And so, unless you provide the hospitality side, right? Enjoy, like, events, things of that nature that at these locations make it more interesting for individuals to stop in. So, with cannabis hospitality, it brings about an industry that they understand, and I mean the legislatures. We have a hospitality industry statewide, right? That is our hotels, that is, even, I would say, restaurants, alcohol, like we provide tourists a place. Sorry about that. We provide tourists a place to have access to many different things, except as a state, regardless of us having a legal industry, we don't, as I saw in the comment, have a single mention of cannabis on our Department of Tourism, much less our state marketing organizations. And so the idea is that it is a more understandable way of talking about this, and more importantly, from the consumer aspect, it is speaking to their lifestyle and use of this plant, the things that they look for when they are engaging with businesses and going out. So I hope that was a good answer for everyone in there. And if you have questions about it, let me know.
I do also want to add, I'll let you take a break there, Lotta, for just a minute. Yeah. I do want to add, the main concern that we are running into with this bill, while a clean air is a part of that, like I said, I think we've kind of handled it pretty well, is of course the public health and prevention, public health and safety side of things. There's a lot of concern about overconsumption, and then in particular overconsumption where it meets then people driving afterwards. We've been in conversations. We had a really excellent conversation hosted by the Liquor and Cannabis Board. 2 months ago around cannabis hospitality and social consumption. One of the sort of primary tenets of public health and prevention, whether it's alcohol or gambling or cannabis, is a non-expansion sort of posture, which is to say, we're going to regulate this thing that's here, but we don't want to expand it. We don't want to grow this industry. We perceive it as harmful. We, of course, on the cannabis side of things, are always sort of pushing back a little bit that cannabis and alcohol, while we sometimes talk about desiring parity in regulation, we are also very, very different. There is no medical application for alcohol except for high concentrations in cleaning surgical supplies and things like that. But in terms of people ingesting alcohol, there really is no sort of like medical application in that regard. Whereas cannabis, there's a lot. Also, with alcohol, there is a per se amount that we know that everybody sort of agrees. And of course, we all know from experience, it's a little squishier than this, but by and large, we understand what intoxication looks like and how much it takes a person to get there. Small variability on gender and size, but by and large, we can say if you've had this many drinks, or and as the law is written, if you have a blood alcohol content, you are considered impaired and therefore in violation of the law if you're operating a vehicle. Cannabis doesn't follow that format. I assume everybody here has experience with the plant, and I was having a conversation with somebody earlier in the week about, they were saying 100 milligrams in an edible is what I need to get me there. And by there, that is medicated. Aches and pains are going away. They don't feel too terribly impaired. For me, that would be a trip to outer space for 4 days. I'm a 2 milligram girly for the most part, 2.5 milligrams, but my body does something different with Delta 9 than hydroxy 11. So if I'm smoking, I can smoke pretty tough, but that doesn't show up in edibles. Whereas somebody else, it's a couple of puffs and they're done for the night. So without that sort of consistency in how the body, how everybody's individual body and their endocannabinoid system processes cannabinoids, it's really hard to then write universal policy about what overconsumption and what impairment looks like. So we do have a lot of challenges there on that front. However, what I would say to all of that, first and foremost, in particular, speaking to this idea of expansion, we all agreed that we wanted to legalize and regulate adult use cannabis in Washington state because it was activity that was already happening. I also want to go back to allowing alcohol sales in bars. That happened because the state, and from a policy perspective, wanted sort of supervised places where people could consume alcohol so that there were opportunities to prevent overconsumption and societal harms. So we all agreed that we wanted to regulate cannabis, and by denying an opportunity to also then have safe spaces, safe cannabis deserves safe spaces, without having the opportunity to have safe spaces, we haven't completed the task. We're not done with I-502 yet until we have also then ensured that there's a safe place for people to consume their cannabis. And so I would say this is not expansion. This is just completing the task that already began. And then once we have these places, those become really powerful places where we can share a lot of really critical information about overconsumption, about detailed information about cannabinoids, the endocannabinoid system, things like THC percentages and lesser cannabinoids, so that people are having the experience that they want that doesn't look like just getting as high as possible and then getting behind the wheel. I think that that's a really actually already uncommon. And side note, there is research out there that shows that when people consume in groups, they're less likely to overconsume than when they consume at home. I don't know if you all have had this experience, but in 2020, when it was just me on my deck, I could be scrolling on my phone, enjoying myself, and then I stand up and go, oh, that was a lot. Whereas if I am in a social setting and I'm consuming cannabis, I have an immediate feedback loop for how that cannabis is affecting me, and I am less likely to overconsume. Actually, very much less likely to overconsume when I'm doing that in a social setting. So there's a lot of arguments. I know it's nerve-wracking for folks. It's something that's fairly new, but I think that there's a lot of good, solid argument and science for why this is a necessary sort of completed step for realizing the will of the voters with I-502. That's my soapbox.
I love the soapbox. So to really sort of explain why this matters for policy strategy, House Bill 1932 represents a foundational shift in the regulatory landscape, not in the landscape of what we do, right? And so from cannabis as a product sold but not consumed in regulated spaces to cannabis as a part of the broader hospitality economy. Its success or failure will shape future legislative efforts around social consumption, tourism, community events, and public health policy. As advocates, regulators, and industry stakeholders, understanding House Bill 1932 helps us frame the conversation around safe, equitable access to legal consumption spaces, advocate for practical public safety measures, and aligned industry needs with legislative intent for sustainable growth. So, if you have any questions or if you are interested in testifying on behalf of this bill or helping with our agenda, one, please tap in with the Cannabis Hospitality Committee. Two, watch that almost 2 hour webinar we put together with some fabulous stakeholders or subject matter experts from the science to the ticketing, right? Sector that we're dropping nothing but data and facts in this industry or about this industry and this landscape. And three, let us know if you want to testify. Join us on Lobby Day. We could use your voices. So I'm here to answer questions from you all.
I'm going to jump in on one of the questions that's in the chat around advertising and Cannabis Commission. And so, yes, there's lots of prohibitions on cannabis advertising within Washington state. And then because it is federally illegal, anything about cannabis that is crossing sort of state lines, as long as we're calling it adult use cannabis slash marijuana, as the federal government calls it, it is technically illegal. Though also, I like to remind everybody the broader context of everything we are doing is federally illegal anyways. And then Keith in there mentioned a cannabis commission. That is a project that we have been working on for quite some time. It's on pause, but not sort of left behind entirely. It's on pause just because cannabis commission is funded by fees from producer processor, or from processors. And the project we were working on was a commission here in Washington state for the purposes of research and industry development. Right now, however, due to price compression, we're losing about a farm a week right now, and so adding additional fees is, I think, really cold comfort. So we're doing triage to save the industry first before I think we can responsibly move forward with the commission. However, the idea was to set that up so that when there does become some sort of level of interstate commerce or ability to advertise tourism outside of state and include cannabis in that, we'd have that commission already set up. And then also as a side note too, there is actually though nothing stopping folks in Washington state advertising tourism as it's related to cannabis. It is really that the state doesn't want to. The people who are in charge of making decisions really enjoy the $1 billion a biennium that we give them, but they would like for us to stay very quiet about it, if we don't mind. Hopefully you've picked up some of my frustration in the tone of my voice with that.
May I make a comment?
Yeah.
Has anyone ever flown into Palm Springs? The first thing I noticed when I got off the plane to get my luggage, all of the turnstiles were just covered with cannabis advertising. I mean, they want to sell it, you know. It is, I mean, clearly these are visitors, they're promoting it, and it seemed normal to me. You know, you've got adults there, and I don't know.
Yeah, if you just wanted to take a look at Cali as an example as a state, I mean, they have their fair where they're is direct to consumer sales occurring. They're one of their state fairs, and they had social
Oh,
equity businesses there. The state's certain like Visit Oakland, those are state marketing destination organizations, right? So like different municipalities, like they themselves worked with actually Brian Applegarth and I believe it's CTA is the organization to craft tourism I guess outreach options to where if you if you signed up for it and you bought the app or the virtual pass, you would go to a list of locations and get a gift or a freebie for visiting these sites. So it is such it's not only incorporated at their airports, but it's to the point that it's being displayed on their websites and advertised, and these businesses are being promoted. So again, it is a state outlook on the industry as opposed to um, uh, anything else.
yeah.
I do also want to say a little note as well, and I think the Ryan's Law that the compassionate care, is sort of the beginning of this. We have had lots of internal conversations over the years too about cannabis hospitality or cannabis social consumption. Um, uh, Also, there's this other piece of patients and patient access, people who are in long-term care facilities and apartment complexes, and ensuring that there are just places where people can get their medicine. That's not a business model around events or restaurants or things like that, but literally just safe, compassionate consumption. And so this bill does not address that, but we've been very cognizant of the fact that that is also a deep need to have here and as a part of that conversation. And like I said, that compassionate care bill is sort of the beginning of that. But as I was just talking about, previously with how we've got different levers and different ways that laws get passed, working comprehensively with those halves of loaves, so that we may not always get the whole loaf all at once, but we can maybe end up with one and a half actually if we go at it bit by bit again in a more comprehensive way.